Hello, everyone, and thank you so much for joining us today. My name is Jenna Quinn, and it's my pleasure as the Assistant Director of Alumni and Affinity Engagement to welcome you all to this edition of the 49er Industry Chat Series. So just so everyone is aware, this session is being recorded. So really what that means for you is that this will be available to you again on demand on our website at www.csuob.edu/alumni. So feel free to watch it again, share it with a friend or a colleague, or anyone else you might think might get something good out of this. And now with that, I'm so happy to introduce Lauren Sylwanowicz. No, I still messed that up, but,
Okay.
welcome, Lauren. Thank you so much. And please, your last name for our audience.
No problem. Lauren Sylwanowicz.
Sylvanowicz.
Thanks for
All
having
right,
me.
awesome. Well, let me read off a little bit of your bio so that way folks can get to know a little bit about you first. So Lauren is an emergency medicine physician who lives and works in Long Beach. She takes care of patients at St. Mary's Medical Center and focuses administratively on education of internal medicine residents and emergency medicine residents. She also works for Mobile Health as a consultant for product development with a focus on preventative medicine. Her undergraduate degree is in biology and physiology with a minor in chemistry from California State University, Long Beach, where she graduated summa cum laude, was captain of the Division I women's basketball team, and an academic All-American. She went on to medical school at the University of California, Irvine, and stayed there to continue her training, completing a residency in emergency medicine in 2019. Medicine has been her passion for many years, but she is also a wife and a mom to 2 children. She and her husband, a local dentist, have many hobbies, which include spending active time outdoors, on the beach, exploring Long Beach, and adventuring in the United States and all over the world. Thank you so much for being with us today.
Thank you for having me. I'm very excited.
Yeah. Well, then let's just start off. Let's dig right in. And let's start with a little bit of background about you. Can you tell me more about your life and your experiences and everything that kind of led you to the beach in the first place?
Definitely. So I grew up locally. I grew up in Fullerton, which is North Orange County, about 35 minutes from Long Beach. As you already mentioned, was a basketball player. So that was a big part of my high school and childhood life. And in high school, I was recruited. I was very fortunate to have a few scholarship offers to schools in California and across the country, even back east. But when the decision came down to it, I really wanted to stay close to home, wanted to be at a place where I thought I was a good fit for the basketball team, and also to start exploring academics more. So Long Beach was a great fit, and I am so lucky that I chose Long Beach because it ended up a lifetime fit as I now, as you mentioned, live and I've stayed in Long Beach. So basketball is what led me to Long Beach ultimately, but I think also logistics and the location as well.
Yeah. Well, and I would love to, hear a little bit more about that student experience, right? Because a student athlete is in and of itself such a unique experience.
Definitely. It was a full-time job, more or less, I think, on top of school. It did allow me a lot of opportunities in that I got priority registration, was able to build my schedule and get classes done in a timely manner when I needed to. Also, going back to my high school experience, I went to Troy, which a lot of people know is in Fullerton. It's a magnet school, so I had done quite a bit of college credits even coming in to Long Beach State. So it allowed me to have a good balance with academics and basketball, having had some of the freshman courses already completed. And the experience of basketball itself, it set me up in the long run. I think even to this day, I'm a better physician, I'm a better mom, I'm a better friend because of my experience with basketball. We were up and down as far as how good we were that back then, wins and losses. And so it presented a lot of challenges, and I faced a lot of adversity in those years. It also helped me develop leadership skills that I still use today in my industry for sure. And just that teamwork and camaraderie that, you can get in so many different facets, no matter what you decide to do as far as extracurriculars. But I definitely got to experience that with basketball.
Yeah, for sure. And I mean, not easy juggling that student athlete experience and a really difficult major like biology. I
Yeah.
imagine, how was, juggling those really two demanding workloads.
Yeah, I was on I would say a pretty strict schedule as far as the training, the classwork, and I think in a way became almost machine-like in that every day, I knew I had these hours to study. And in some ways, I think because my time was limited to study and to put into the academic side, it became much more efficient in my studying and what I could do to prepare for classes and exams. And again, I think moving on into medical school, which everyone has to do to become a physician, it really gave me solid groundwork for moving forward.
Yeah. I mean, did you have, many peers that were kind of on your same track, or did you, have professors that you were able to lean on for support, or, anything like that, or maybe folks you still keep in touch with today?
Yeah, so I would say actually, to begin with, I felt like I was the only one on that path. And I think mentorship is huge. And because of that, I've been very active in mentorship, even since leaving Long Beach State. I think you can't get to where you're going without, someone to support you. I did, my mom is a nurse, my dad's a respiratory therapist. So I did have family in the healthcare field, but no specific physician, or I didn't even know really, other than a few friends of my parents, like a peer or someone ahead of me who had gone to medical school. So it was still a big mystery to me, the application process, the exams to even apply. I did find within Cal State Long Beach some mentors. At the time, there was a pre-health organization which provided a lot of opportunities. And then, interestingly, coming full circle, I ended up volunteering while at Long Beach State at St. Mary's Medical Center, where I now work. I was a clinical care extender volunteer, which they was a long historic program at St. Mary's. They took it away briefly because of COVID, and it's coming back, which is so neat to see. But that was, I think, the huge opening door as far as gaining some mentorship in Long Beach, moving forward into my career.
So, I mean, how did you know that you wanted to go into the medical career in the first place, the medical industry in the first place, and that you wanted to pursue it as a career? Was it something that you always knew about, or did you find your way
No,
there?
not at all. So my mom will, to this day, absolutely tease me that I'm now an ER doctor, and I was the kid who like screamed and yelled away, ran away from the pediatrician like as soon as they walked in the door, and getting a shot was just a nightmare. But somehow here I am, 30 years later, 30 something years later. But actually, when I started at Long Beach State, I thought I wanted to be a veterinarian. And so I was entering kind of the science. I liked science. I wanted to go into some sort of like physiology science type field. And I thought I wanted to go to veterinary school, and actually had looked at UC Davis quite a bit because of it. But then when I really, throughout the first year, when I really thought about it, I just enjoyed connecting with humans. And I really enjoyed the compassion and the empathy that went into medicine. And again, even when I think I had those initial thoughts and feelings, I'd had no idea what it even meant to be a doctor. And I started that program at St. Mary's, the clinical care extender program, where I volunteered 4 hours a week. And that allowed me to see, even with having a mom as a nurse, I didn't really even truly understand what nurses did versus therapists versus doctors versus physician assistant. So I think that opened the door to kind of see the scope of things. And at the same time, as I was progressing through school and basketball and entering leadership roles, I think I thought, 10, 20 years ahead, and I wanted to be the leader on the team. And that's kind of what I saw when I was a volunteer. And I think ultimately that's led me to choosing the role of a physician.
No, I mean, makes perfect sense.
Yeah.
So, you know, anyone who's interested in going to med school, right, definitely has to take the MCAT.
Mhm.
So, how was that experience for you? I know it's really daunting for a lot of folks. And were there any things that you did in particular that kind of helped you prepare?
Yeah, so I started studying my senior year. And I think actually a piece of advice is to have time that's just dedicated to studying for the MCAT, whether that be a summer break, a winter break, or after graduating. I think I started when I was finishing basketball season, like finishing all of my higher level bio classes, chemistry classes. I can't even tell you which ones they were now, but I think I honestly, the first time around, took on too much while I was studying, and I ended up taking again with dedicated study time and a dedicated Kaplan course. I did it in person, and I think that was just a much better experience. So my first piece of advice would definitely be to give yourself dedicated time, and not rush the process. Medical school is 4 very difficult years. It's really actually, even when I started and after, it's pretty rare to go straight from, a university to medical school with only a summer off. I would say the majority of people now take 1 or 2 years. I took 2 years, which at the time seemed like a lot. But now I think it was a great 2 years. I got to travel, study MCAT, do some even like nannying, working. I worked in an ER. I just kind of got to live life outside of school for a couple years. And I think moving into medical school, I was refreshed and ready to go. So everyone's path will be different, but to answer your question about the MCAT, I would say some dedicated time and don't rush it.
Yeah, no, making sure that you're really ready and prepared, it
Mhm.
sounds.
Exactly. Yeah.
And so when it came time to look into med schools, I'm sure you looked at a few. So what kind of pointed you in the direction that you ultimately took? What were those deciding factor criteria for you?
Yeah. So I was excited again to get it into when I got into UC Irvine. I was actually I remember I was waitlisted at UC Irvine. I was planning to go to UC Davis, and then I got a call for Irvine, which I think was a great choice for me. Getting to stay local, networking, having that family support nearby, not being off on my own. I think that saved time and money, and just again to have that support. So ultimately, UC Irvine was a great fit at the time as well. They were very advanced in medical education and using technology. So we were, right when I was choosing to go there, they gave the first class all iPads, which when I was at Long Beach State, it was just starting to do anything online. So we were all books, and this was huge. And now it seems like nothing, but that many years ago, which isn't that many years ago, it really seemed like they were innovative in how they were teaching us to practice medicine, how they were educating us through the non-clinical and clinical years. And I think that was a big choice for me. And then again, ultimately, heading into the wanting to do ER, it was a strong program for ER too.
Well, about that. So not only a physician, but an ER physician, right? An emergency, you work in emergency medicine. And I
Mm-hmm.
think that, of course, in the medical field, there are just so many different specialties that you can go that you can go to, right? That you can
Mm-hmm.
take. So, what does a typical day look like as an emergency physician?
Well, to first off answer that question, there is no typical day for many reasons. First is that it's shift work. So
Okay.
I can start a shift anywhere from basically 6 a.m. to 10 p.m. So I might work at 6 a.m. one day and start work at 5 p.m. the next day, and then 10 p.m. the next day. So as far as time of day, I do work nights, weekends, 24 hour, not a 24-hour shift, but I can work at any point during 24 hours. But the good part of that is it's scheduled shifts. So sometimes I'll stay a little bit over, but I can pretty much predict my hours. When I show up to a shift, again, there's nothing typical about it because it's the ER. There's going to always be different emergencies. And that we are at St. Mary's, a trauma center, and we see patients with strokes and heart attacks. So there's really no way to predict what's going to come in. And that's the fun part about it. That's the artistic part about it. And I think it's the dynamics of emergency medicine that keeps drawing me to go back and back again.
So if you were to, I have a two-parter question here.
For sure.
And feel free to have more than one answer, but for the first part of the question, what's the most challenging part of your position?
Because it is such a high acuity part of medicine, we deal a lot with death and dying, whether, we see it, whether it's interacting with the patient or with the patient's family. I would say that's always going to be the hardest part. It doesn't get easier. I had mentors tell me that, and I completely agree with it. You come up with your own style to approach that situation. And I think with years of experience, you start to become more seasoned at it, but it doesn't make it easy. There's no way for it to be easy. So I'd say that that's the most challenging part from an emotional perspective. And each field of medicine has its own emotions and own challenges when it comes to the more compassionate side of it. The more physical side of it is that it is very fast paced. I sometimes see 4 or 5 patients in an hour and answer phone calls and make phone calls and talk to nurses and talk to patients' family. So it's very intense. It's very fast paced. It's very procedure heavy. So I do a lot of procedures in the ER that can, sometimes be like setting a bone, things that are more physical. So I'd say that those are probably the 2 biggest challenges from the more like emotional and logistical standpoint of the my specific specialty. Now, when you choose to go into medicine, there's so many specialties. The ER is not for everybody. I always tease when you get medicals, either volunteers or medical students decide on a field. It's very polar field in that people love it or hate it. There's no real like, oh, their ER was okay. It was like, I loved it, or there's no way I'm going to do that. So it's good to get exposure early on as well.
Yeah, for sure. And I guess maybe the more fun part of the two-parter question, what's the most rewarding part?
The thank yous, whether it's from a patient or a family member. I think getting rewarded with that. I see people on their worst day, whether it's their worst day because they're the patient, or it's their worst day because they're there, helping a family member or dealing with a family member. It brings out the best and the worst in people. And I think at the end of an encounter, when I get a simple thank you, or I appreciate you, or those kinds of comments, it really makes it all worth it.
That's really great. Well, I mean, like you said, right? Emergency medicine is not for everyone. Did you know that that's what you wanted to go into like right away when you got into the field, or how did you decide that that's what that it was right for you?
Yeah, I think it's a great question. 2 things. I think when I knew I wanted to go to medical school, and even if I remember correctly, when I was applying to medical school, I don't think I even realized that you went to medical school and then you went to residency as two separate things. And I don't think I fully understood the continuum of when you needed to decide on a specialty and all of that moving forward. So I actually worked in the ER as a scribe in those 2 years that I was after Cal State Long Beach before starting at UCI. I worked in the ER at Lakewood and Los Alamitos hospitals. And so that really was a great first experience. It opened the doors to looking at the emergency room and emergency medicine, but it also allowed me to see other specialties and other, aspects of the hospital. So when I had that experience, I knew I really enjoyed the ER. But when I started medical school, I still definitely thought I wanted to be a pediatrician. And so the way medical school is set up, the first 2 years, you're pretty much in the classroom. You get some clinical experiences here and there. And if you seek out more clinical experiences, it allows for that as well. But ultimately, by the end of your third year, you have to make a decision. So in your third year, you rotate through a lot of different specialties. And when I rotated through pediatrics, I enjoyed it. But I think I wanted a little more action, a little more procedures, and luckily in the ER, especially the ER I work at, I get to see a lot of kids. And I was also for a short period of time drawn to OB and women's health, but realized I didn't like the OR as much, and a lot of OB is also gynecology, and you do a lot of operating. So I know as I went through those years, I was able to kind of gain those experiences to lead me one way or the next. And ultimately, I think I came back to ER because I had the scribe experience and because I knew, I'd see kids, I'd see pregnant women, and I'd see everything else. And that's one of the challenges of ER. You walk out of a 2-day old and then you walk into a 98-year-old patient. So you really have to know how to care for all ages. And so that's, I think, the path that led me to emergency medicine. At the end of your third year of medical school, you start to apply to residency. And then there's a match program in the fourth year where you're matched with a program of your in your specialty that you chose. And so that's when I got to stay and matched at UCI. But yeah, again, I don't even think when I applied, I really understood, when I would have to make that decision. But there is time and opportunities to kind of explore.
I think that's encouraging for a lot of folks to
Mhm.
know. You don't need to know right away. And honestly, perhaps is it discouraged, people thinking they know exactly what they want to do right away.
I was part of admissions when I was at UCI, and I found that when we talked about applicants, we definitely wanted them to have experiences that showed they were exposed to medicine. Especially now post-COVID, healthcare is changing. I like to think it's changing for the better, but a lot of people are leaving healthcare. And it's a stressful environment in many ways, and medicine has changed in many ways. But from that kind of admissions committee perspective, I think it was interesting to hear, those who I was sitting on the committee with, that they wanted to make sure they were exposed enough to know. But if someone was like, I'm going to be this, I wouldn't say it deterred them from admissions, but it made you question, how do they already know that? Because now years out in retrospect, there was no way to really know until you're kind of more in time in the hospital.
I see. Well, I mean, I'd also love to, kind of explore a little bit more with, what you just mentioned about, COVID and the way that that's changed or is changing the medical field. I can't imagine what it was like to be a doctor,
Uh-huh.
an ER doctor during COVID, and I I'm curious as to, what are some of those changes that you're seeing, and what are some that are encouraging, and what are some that maybe you're seeing and you're more worried about?
I think from the healthcare provider perspective, whether it's nurse, a tech, a physician, a mid-level provider, those years and even post-COVID years came with a lot of burnout. And I think from the patient perspective, those years almost developed a lot of mistrust in the healthcare system, that, kind of became to this clash. Us as providers were a bit burnt out, and here come the patients that don't really even trust us, and that kind of frustrates us even more. And I think that there were physicians later in the career who experienced those years and said, this is just not what it used to be. And I think there had been some turnover and burnout, and many people at any point in their career, and any point at any aspect of healthcare, experience that. What I think is hopeful is that I think coming out of COVID, there's a lot of talk and push to really look at the patient experience, not from a perspective of how satisfied is the patient, but are we providing the compassion, empathy that we want to give, and why we decided to go into healthcare. So I think a lot of people now are looking back at their roots and why they wanted to go into healthcare in the first place. And it's, COVID was so tough. We had so much gear on. We could only spend so much time with the patient. We had to limit visitors, and it was a lot of saying, no, 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 we can't do that. We can't do that. And now, coming full circle and back around, and how can we be even better and provide more compassionate care? And I think it's really exciting to see that. And I hope that, it becomes a better place and a more trustful place for patients.
Well, I mean, I know that, going off of what you said about burnout, you know, just listening to your experiences of, working all kinds of different shifts and, seeing colleagues and everyone else in the field experiencing burnout, how do you manage work-life balance as an emergency medicine physician?
So going back to my basketball years, I think exercise and fitness and, carving out some time for that is extremely important. Sleep is also extremely important. I say that in that I'm not the best because I work shift work and night shifts, and I have a baby and a toddler. So I think always striving to improve sleep is important, as far as avoiding burnout, and then finding a balance. So kind of going back to the question about what my day looks like. I do work a lot of clinical hours. I see patients, I work shifts, and I work very hard when I'm there. But I do other things as a physician outside of the hospital. I do some administrative work. I work with residents and teaching, and making sure their rotation in our department, it goes smoothly and they have a good experience. And then as you mentioned in the bio, work as a consultant too, and I do a lot of that from home, where mobile health is basically an app program, a health and wellness program that companies provide to their employees. And so I work a lot with them on creating programs for preventative care and exercise and fitness and diabetes and nutrition and all kinds of things, sleep and mental health. And so, it allows me to use my brain in a different way. And I think at my stage in the career, I've been out of residency for 5 years, identifying that, just going to the hospital and seeing patients day in and day out will probably end up with burnout sooner than later, and identifying that, growing other points of my career is important.
Yeah, I'd love to hear more about mobile health. It
Definitely.
sounds so interesting. Could you elaborate?
For sure. And I think from a bigger picture, it's a good point to bring up that when you decide to become a physician, yes, it comes with seeing patients, but especially now in the world of technology and everything, there's a lot of other opportunities, innovation, product development, or, what I'm doing. So I work with the company on creating on content. So I'm the kind of first black and white draft of what they want to produce. So if they want to work on building out a program for diabetes prevention, or work on building out a program for diabetics to use, or those with high blood pressure, high cholesterol. We break it down into lifestyle changes, education on their medications, education on their lab tests, what their healthcare providers are doing for them, and how they can be an advocate for themselves. So I usually write out a program, and then it's really neat to see because it goes through many stages of development above and beyond me. They make it look beautiful in an app and interactive. There's questionnaires. And then I come back around at the end and I review the program from a medical doctor's perspective. Is anything something that a doctor wouldn't advise to their patient? Any red flags or changes in wording? And so it's really neat. Like I said, it's a totally different side of my brain. In the ER, I'm usually treating people's problems that, they have a heart attack. If they would have been able to do something like what I'm working on with mobile health 10, 20, 30 years ago, maybe they wouldn't be to that point. So it's kind of fun to think about helping patients or helping users of the app prevent getting to the point where they're in the ER seeing
In the
me.
first place.
Yeah, so it's really a different part of the brain, and I do enjoy it. And it's a great group to work with. So
Yeah, no, it sounds so exciting.
yeah, and there's so many things you can do. I have colleagues doing research or more academics, or colleagues starting businesses or startups. So yeah, I think, you go into medicine thinking it might be one thing and it leads you to others. So
Yeah. And I think that's cool. You never know where it's really going to lead
Mhm.
if you keep your eyes open, right? I mean, where do you feel like these types of opportunities come from? Like networking? Is it coming from uh just word of mouth?
Yeah, I would say networking. I've never even kind of residency, I didn't search for a job. Like I didn't like Google search for a job or use the search engine. I talked to my mentors, which led me to positions in the community. And even I remember back getting led to St. Mary's. I knew a physician at Long Beach Memorial who said, "Oh, there's an opening at St. Mary's." So that was just all by word of mouth. Um, and I think as opportunities arise, if you keep in touch with mentors, if you keep in touch with your network, those opportunities are given to you. Since starting at St. Mary's, I work as a partner in a larger physician group called Vituity. And Vituity has also allowed me to explore a lot of leadership training programs and, early in my career that have set me up to different opportunities as well.
That's great. And
Mhm.
touching uh touching on something you just said and something you kind of started this chat with, but the role of mentorship, right? In the medical field, it sounds like it's incredibly important. Could you explain a little bit about, your history with mentorship? Who've been your mentors, and who are do you have any mentors? Who are mentees? And just like your process for that.
Yeah, so I think at each stage, mentors are important for different reasons. So thinking back into my early years at Long Beach State, I think mentors were important to talk about the good and the bad of medicine, to talk about, like we did today, what a typical day looks like, what challenges you face, compensation. It's changed a lot over the years, medicine has. So it's good to have mentors at different stages in their career as well. I think when I was at Long Beach State, I, in retrospect, would have liked mentors that were either closer to me in proximity, like in medical school or just out of medical school. Because, like I said, I think I entered medical school still not really even fully understanding the process. And there's pros and cons to that. But I think in the early stages, mentors are important to really decide, is this what I want to do? Do I want to follow you or do I not? And to really hear the reality of the field. And then once you get into medical school, I think mentors are important, particularly in the field you decide to choose to pursue, in that they provide you with that network. And they also provide you with support. If it's each field will present its own challenges. And like I, said earlier, what's the hardest part of your job is it comes with a lot of emotion. And so to help, mentors to help you on that side of processing those emotions and the mental health aspect of, really facing some adversity, I think it's important throughout all stages of the career. And then now at my point, I think, having mentors in leadership positions within my partnerships of physician, that's kind of like the next stage of the career for me. And I think talking to other leaders and how they're helping patients without actually going to work and treating that specific patient and helping with the wellness of providers as a whole has really been neat to see kind of as I enter the second stage of the career.
One, I mean, you also serve, working with the internal medicine residents
Yeah.
and emergency medicine residents, and I imagine that kind of allows you to be a mentor as well.
For sure. Yeah, it helps me kind of stay in touch with where they're at in their training. We have a new resident every month rotating with us. So, and they often come back around and ask us questions when they're ready to decide whether to enter community medicine or maybe go into academics. So that's been really neat. And then I'm blanking on the program at Long Beach State, but I have a lot of students reach out to me, and I've had several phone conversations and stayed in touch with some students that have questions about the MCAT or applying, and that's been really neat as well.
Well, that's great. So I think you talked about like a lot of the opportunities that present itself with emerging technologies and the way that's going about. And so I'd honestly love to get your take on, obviously medicine has always been a hugely technologically progressive field, but now that we see some of these more hot buttony types of technologies like AI, do you feel that AI is going to have a significant presence in the medicine field, in the medical field, or do you think it's a good thing, a bad thing?
Yeah, I think it's inevitable. I think it's a good thing and it will come. What I would love to see it help is, one of the, I guess, going back to the challenges of being a physician is you spend a lot of time documenting what you're doing. Honestly, sometimes it feels like you're documenting what you said to the patient more than you actually spoke to the patient, just because of the way the legal system is and the way we bill. We really have to document well. And I think in my specialty of emergency medicine, I think I'll likely first see AI come into play in assisting with charting. And I think that would be huge from a wellness standpoint and a longevity standpoint, as I would love to have more time with patients and I would love to have less time spent on the computer. So if and when AI comes into the more EMR, which is the medical record or the documentation aspect of medicine, I think that would be phenomenal. I've recently heard talks on how AI will really change the field of radiology and even surgery and in surgical planning and diagnosing pathology and problems based on X-ray images and CT scans. So I think those will probably be the first two places we see AI really assist healthcare providers. And I like to think of it as it will assist in the future and not replace us, because as we talked about earlier, there is a huge emotional, compassionate, empathetic side of medicine that artificial intelligence will not be able to provide when caring for a patient and really trying to heal a patient, whether it be physically or emotionally. And so I think that's a place that where we would never be replaced. But I think it will only hopefully assist and maybe even help with the wellness of our day-to-day practice.
Awesome. So no risk of WebMD AI bot taking your place.
Right. Yeah, I'm sure. I mean, people, yeah, patients always tease, this is what I Googled and this is what I think I have. And, people are usually now even more upfront about that than ever. And, hopefully it will just be able to provide the patient with better education. But at the time will tell. Yeah.
For sure. Well, so how do you find you know how do you find is best that you're able to stay up to date with your medical training, continuing
Mhm.
education or just general trends in the field?
So we definitely have CME, continuing medical education requirements. I work with a partnership of physicians, which our organization is called Vituity, and it's actually really neat because I am in a partnership of thousands of physicians across the United States, predominantly working in emergency medicine, but also other specialties. And that larger network and that organization really provides us with a lot of education on keeping up to date. So I would say from an organizational standpoint, it kind of trickles down to us. But there are podcasts, there are things I read. There's actually stuff here on my desk that helps me to stay up to date. And then, as you brought up back up, working with the residents. So they're always challenging us, right? They're asking us questions, which in an academic setting, people really keep up to date. And then when you start to work in the community, you really focus a lot more on your healthcare system and less on the day-to-day of studying the field. And so I think that working with the residents really helps to keep you on your toes, more or less.
That's great. That's great.
Yeah.
Well, I always have a hard time believing it, but we're coming up close to time.
Okay.
So I would love to ask you just one of my favorite closing questions, which is, if you had a time machine
Hmm.
or a magic wand and you could take yourself back to yourself right when you were getting ready to graduate from CSULB,
Uh-huh.
um, what piece of advice would you give yourself?
I would say follow your instincts. I think I have done that. And I think it led me to emergency medicine, which is a specialty I'm very happy with. It's a challenging specialty, but I am very passionate about it. And I think having that experience of basketball at Long Beach State, helped me develop a lot of passion, teamwork skills that I wanted to hold on to as I moved forward in medicine. And I think that keeping those initial instincts and not straying too far from the plan has allowed me to get to where I am today. With that said, I think I was presented with a lot of opportunities that I really am grateful for, and I took advantage of those opportunities. And sometimes filled my cup a little too much or pushed myself a little too much. But now, where I'm at today, I'm very, very happy I did that.
Awesome. Trust your instincts. I like it. I
Yeah.
think that's great. Great advice. Awesome. Well, Lauren, thank you so much for your time today. This has been absolutely great. And
Thank you for having me.
yeah. And for those of you who joined us, thank you as well for tuning in and for sticking with us. And I do hope that you were able to get as much out of this as I was. And just as a reminder, this will be available to you again on our website at www.csulb.edu/alumni. And feel free to follow us on all of the social media platforms. We're at CSULB alumni on all of the different platforms, so you can stay up to date with us and see what will come next, and reach out to us if you have any questions. But Lauren, if anyone had any questions for you, how might they be able to get in touch with you or continue the conversation?
Yeah, I think email would be best. My email is my last name, Sylwanowicz, MD, at gmail.com, but maybe you can post that as well or link it.
Awesome. Well, thank you so much And until next time, we'll see you. Have a great day. Bye.